Good evening, everyone. My name is Shiyu Lin. You can call me Johnny as well. And today, I'm very honored to be invited by the RWD Science to participate in this webinar. And today we're going to talk about the application of photobiomodulation in intervertebral disc disease in dogs. And first of all, I would like to introduce myself. And I graduated from Zhengshan University in 2012. Then I went to the University of Queensland and I studied my master's. And since then, after I graduated from Australia, I came back to Taiwan, and I have been devoted as a clinician in Kaohsiung, and I started my rehab careers since 2017, and I got my CCRP license in 2018. And since then, I have been doing a lot of rehab, including like dogs and cats with orthopedic problems. And some of them, they have like neurological problem, like what we're going to talk about it today. And I'm very honored to be invited to several seminars and to be the speakers, especially this year. I went to the Singapore that show and talk about laser therapy in dogs with orthopedic problems. And this is the try to introduction of myself. And here is where I work. This is the physiotherapy consulting room. So there will be a table where I did my laser therapy. I did my manual therapy and even like electrical stimulus on this table. And I try to work on the therapeutic exercise on the floor. I do cavalettes, I do like balance board, I do like sit to stand exercise with my patients on the floor. So this is pretty much my physiotherapy consulting room. And this one is my underwater treadmill room. There are two underwater treadmills, a small one and a big one, which is the big one, it can fit the dog to up to about 70 kilos. And the small one can fit the dog about 20 kilos. Yes, and they both work very well. I try to do the underwater treadmill here. And today we're going to talk about first of all, we'll have to introduction of the intervertebral disc disease in dogs. Then we will do a introduction of photobiomodulation. Then how do we diagnose and evaluate the IVDD patients? And finally, we have one case study to share with all the doctors. And first of all, sorry, I just have to go back. First of all, I would like to talk about what is IVDD. IVDD is a disease which cause some like the nucleus proposes excrusion causing spinal cord compression. And some of those disease happen in chondrodystrophic dogs, and some happen in non-chondrodystrophic dogs. And there are several different types of IVDD. There is like hydrated nucleus proposed extrusion, like HNPE, and there is like a embolization, such as like fibrocartilaginous embolic myelopathy, like we call it FCE. Then we have Hansen type 1, type 2, and type 3 intervertebral disc extrusion, which is most familiar to all of the doctors. So what are these diseases? We're going to explain it we're going to explain one and each other. First of all is the intervertebral disc disease IVD in dogs. Like we can see the picture on the left. This is a normal intervertebral disc. There's a spinal cord and there is the there is the nucleus pulposus, and it's surrounded by the annulus fibrosus, okay? And in Hansen type 1 IVDD, we can see there is a degeneration of the nucleus. And it can be acute. The degenerating material from the center of the disc will herniate and compressing the spinal cord. And this mostly happen in chondrodystrophic breeds, such as like Dachshund, Shih Tzus, or Peking dogs. And it happens in around 4 to 8 years of age, and some happens even earlier in 2 to 3 years of age. And we have the Hansen type 2 IVDD. It's a more gradual, and the outer part of the disc material gradually protrudes and causing progressive compression of the spinal cord. And it can happen in all breeds, and it typically affects non-chondrodystrophic breeds. And it happens when the dog's around 5 to 12 years of age. And the most important is both of the Hansen type 1 IVDD and Hansen type 2 IVDD, they have the degeneration of the nucleus, so which causing there is protrusion or the annulus fibrosis in type 1, it breaks and causing the compression. And now we have the Hansen type 3. Hansen type 3 is quite interesting. It's like an acute non-compressive nucleus pulposus extrusion. And it is like a small portion of the healthy, hydrated, non-degenerate nucleus. It's fired through the annulus, hitting the cord at some speed and causing the considerable conclusive effects to the cord. And it can happen in all breeds. It can happen in 4 to 6 years old of chondrodystrophic dog, or it can happen in 6 to 8 non-chondrodystrophic dogs. And here we have another disease. We call it like fibrocartilaginous embolic myelopathy. And it's more, we call it like a FCE. It's not a herniation, it's more like a embolization. And it is a small piece of fibrocartilage from a nearby intervertebral disc and make its way into the bloodstream and lunges in the blood vessel that supplies the spinal cord. It can happen in miniature schnauzers or like shitties. And it can happen in young to middle-aged dogs. And there are some neurology terminology, we can call it. First of all, is paresis, and it means the inability to move body part with appropriate strength. And we have plagia, which means paralysis, and it means that the dog is inability to move body parts. And we have ataxia, which is impaired coordination of movement. And the last one is the proprioception, which is the knowledge of where body parts are in space without having to look at them. So we can see the picture in this slide. We can see the dog has no proprioception, and it seems the dog is like, it has severe paralysis because the dog has inability to move the body parts. And there are some signalment of type 1 and type 3 IVDD, because this type 1 and type 3 IVDD, it happens acute instead of chronic. So we can see there is a per acute to gradual onset, and there will be spinal hyperphagia, which means that they're very sensitive to the pain. So when you touch their back, they can be in a great pain. And they have abnormal posturing, there's muscle spasm, and there's paresis or like paralysis, and they have abnormal reflexes. Depends on which part of the herniation is. And there might be decreased or absence of nociception. Okay, so we can see the dogs, they will have like very abnormal stance, or they can be ataxic when they're walking, or they do not want to walk, or they're like severe like neurological lameness. It can happen, and some even more. And in most of the case, it starts with pain. So when you touch them on the back, they might be in a great pain, and you might think, oh, this might associate with like the type. This might associate with the disc problem. And in signalment of type 2 IVDD, it happens in older or generally in large breed dogs. And it can be more chronic and slowly progressive paralysis and pain. And in the beginning, we can see that the dogs, they are reluctant to jump or to use the stairs, and they have difficulties in standing up and sit down. They might go like when they want to sit down, they might go around and they might think which posture suits them the best. And in some cases, this kind of dogs, they can be acutely worsened. Okay. Then we're going to talk about myomalacia. It means a spinal cord softening, and it also means that there's ischemic death of the spinal cord, and it can be focal, but often progress to be ascending or descending form. And it is really fatal due to the progression cranially to the areas of the spinal cord controlling respiratory muscles, because it stops their breathing, and the dog would dead if it affects the spinal cord controlling breathing. And it occurs in 10% of the patients with acute paraplegia. Okay, now we're going to we talk a little bit about IVDD, and we classify some of the types of the intervertebral disc disease. Now we're going to back to the photobiomodulation. And what is photobiomodulation? It means laser in the past. And what is laser? And a laser is the device that emits a beam of coherent light through an optical amplification process. And there are many types of lasers, including like gas lasers, fiber lasers, and much more. And nowadays, we use the term photobiomodulation therapy to indicate the laser therapy and physiotherapy. So here is the classification of photobiomodulation, and they are classified for safety purpose based on their potential for causing injury to humans' eyes. And most laser products are required by law to have the label listing the class for visible being consumer list. And there are 4 main classes. And the first 2 classes are relatively safer for eye exposure, and the last 2 are hazardous. The chart shows how the eye injury hazard increases as the laser's power increase. So in lasers or photobiomodulation, we use class 3B or class 4 lasers, class 4, and they both requires us to wear the goggles, because it might harm our eye when you're doing this therapy. So there are 4 things that can happen when photon strikes the tissue. There are some energy strikes back. We call it reflection, and some will penetrate all the way without interacting with the tissue. So we call it, so it just penetrates. And then some will be scattered, and about 20 to 40% of them actually get absorbed by the tissues. And when we're doing the laser therapy, it is better to part the patient's fur and let the probe contact to the skin, for which to maximize the power absorption of the laser. And here is the biological effect of photobiomodulation, and it shows the photochemical effect of laser therapy in tissue. And laser light with specific wavelengths like 670 or 808 or 905 nanometer will be absorbed by the chromophores to increase the enzymes activity, such as like cytochrome C oxidase. And as a result, that three molecules are affected: the ATP, the ROS, and the nitric oxide. And these molecules can be facilitate wound healing and give more energy to the cells and transport oxygens and immune cells to the tissues. So we can see these in this picture: ATP and ROS and nitric oxide can be affected when we're doing the photobiomodulation. And when enough mitochondria are engaged by the CCO absorption, it mediates a series of biochemical reactions in the tissues that lead to, first, reduction of pain, and there is modulation of inflammation, and an increased microcirculation. So what can photobiomodulation affect? How do photobiomodulation affect pain? First, it increases serotonin. Then the beta endorphin will release, and it increases the acetylcholine and decrease the bradykinins and direct analgesic effects on nerves, okay? And there are some clinical effects of photobiomodulation therapy. There is angiogenesis and neovascularization, which increase the oxygenated blood, accelerates tissue healing, and increase the collagen production and cause proper alignment and remodeling of the collagen to reduce scars and improve the elasticity, in which it also increases muscle regeneration and decreases muscle atrophy by activating the satellite cells responsible for muscle regeneration. Also, it increases the regeneration of nerve and promotes axon sprouting and myelin formation. And this effect is the main effect that we want when we're treating our IVDD patients, when we're doing the laser therapy. Also, it increases cartilage production by increasing chondrocytes and collagen production, which also increase bone formation by causing proliferation of the osteoblasts and accelerate bone repair. So here, the first one, increase the nerve regeneration, which there are a lot of papers and talking about how the nerve regeneration can be accelerated by doing the photobiomodulation. Here, this is one of the paper that it shows that the low power of laser had, that would actually shows you that the laser therapy which would affect the peripheral nerve regeneration. Also, there is another paper talking about the photobiomodulation therapy, and it shows that the peripheral nerve regeneration has been improved by when we're doing the photobiomodulation. So we talk about IVDD, then we talk about laser. Now we're going to talk about how to diagnose and how to evaluate our IVDD patients. So in a lot of cases, we can see, first of all, there is back pain, and there might be abdominal pain, and sometimes it can be very hard to differentiate. So how can we diagnose IVDD? First of all, it is very important to perform a near exam on the patient, you should feel the patient with your hands, and you should palpate their spine around their from their thoracic spine to their lumbar spine, even the neck spine, even in the neck, even around the neck, because IVDD can happen in around the neck as well, and we can test the range of motion of their each vertebral body. If the animal is very painful, then do the spinal palpation less. You can find that the patient they're in a great pain when you just look at them, or even when you try to touch them, you can feel them, they are like screaming, or they're like because it's a really painful disease. And we can see we can also do our motor assessment to see how they walk and to do the gait analysis. Also, we should do a complete blood count, like the chemistry profile or like the tick testing or the viral test, because some systemic disease can affect or can affect these kind of can show there is neurological problem in these patients, such as like infective like meningitis, or like hormone disease. It can cause vasculitis, and they can affect their neurological examination as well. So this one is one of the videos that shows a IVDD patient. The dog has done the CD examination and the X-ray examination, and it seems that the dog has a problem of using the hind limbs. So it was like the the dog is very obvious paraplegic. The dog was not able to move the hind limbs, and this is kind of like what we have to do before we do any rehab. Okay. Also, we have to do the diagnostic imaging. We can do the radiographs, and the radiographs like X-ray may not be useful in our IVDD patients, but it provides the information about malformation and spinal fracture or malformations. In the past, we do like myogram, and we can see if there is any like herniation of the disc problem. And now we have more tools such as like CT with myography, and it's quite fast, and it can identify compressive or like acute type 1 IVDD patients, and we can get a lot of information. We can get where the extrusion is, the side, and how serious, how the extent, how serious it is. But it does not provide information about the health of the spinal cord, like myomalacia. And it's helpful in evaluation type 2 lesion as well, but it does not always differentiate IVDD from neoplasia. If we want to do if we want to differentiate IVDD from neoplasia, maybe we should do like an MRI to see what exactly it is. Like MRI is best for evaluating the intervertebral disc, spinal cord, and nerve roots, but it does not as good as the bone details. It evaluates spinal cord of edema and gloss, and more prognostic information than CD or myelography, and more time consuming and expensive than CT. So in a lot of IVDD cases, CT is pretty good enough for us to know about what is happening to this dog. Okay, so there is the treatment options in type 1 IVDD. we suggest the patient to rest and give some anti-inflammatory medication, and we do the pain management. And about 6 weeks of cage rest, there's very strict cage rest with no jumping and no stairs for life, because the protrusion can worsen if they're doing some activity like this. And we can give them NSAIDs or steroids. And please remember, do not give both of them these two medications at the same time. And if the dog is very big, if there is no like pain sensation when we're doing the pain evaluation, we should do a surgery to decompress the extrusion. So we do the hemilemiectomy, and we can do a dorsal lemiectomy, lateral probectomy, ventral slot when there is like cervical IVDD patients, or we can do a fenestration. But after all this surgery, we should do rehabilitation. And in type 2 IVDD, we should do an intermittent cage rest, no jumping and stairs, and we should manage their bladder. Also, we gave them the NSAIDs and steroids, but not at the same time. You can choose either one. And we also do fenestration, or like ventral slot or hemilectomy in type 2 IVDD. And we also do rehabilitation as well after the surgery. And in type 3, we the patient can rest, giving the anti-inflammatory medication management, cage rest, and we do the rehabilitation as well. So we can, in this chart, we can see how rehabilitation has a big in this chart, we can see that rehabilitation is very important in all these three types of IVDD problems. We use rehabilitation to facilitate their gait, and we help them to build their muscles and to make the dogs they have a better living style. So this is the neurological examination form when we do before we face a patient that it's suspected that they have the IVDD problem. We do all kinds of cranial nerve examination, and we evaluate the gait, and we do the posture reactions and we do the spinal reflexes to make sure that which part of this dog is having an issue. And so this is what we can do before the surgery. And after the surgery, we have to do the neurologic examination again to see whether the reflex or the reactions has been improved. So we do this like most after the surgery. When we do before the rehab, we do it like every day to see whether there's any progression of their reflexes. And this is how we evaluate our rehab. Our rehab. Should we add more rehab on this dog if this dog is not progressing, or what we can do to help this dog? The neurologic examination is very, very important. So we can evaluate the neurologic gait. The grade 5 is the best. There is normal strength and normal coordination. There's no obvious dysfunction. And in grade 0, which is the absence of purposeful movement, it can be tetra or paraplegic. Okay. So this is the 2 videos that I can show you guys that how this dog walk. We can see the beagle is quite a tactic. It walks like a robot. So we can grade the gait to about grade 4. Then we can see another one. apparently there is no voluntary movement of the hind limb. So this dachshund is the walk and trot is the grade 0 gait. And obviously this dog is paraplegic. Okay. Also, we can do the muscle girth measurement and range of motion when we are doing our when we do our rehab. After we do our rehab, we can see if there is any muscle when we're doing the muscle strengthening when we are doing the muscle strengthening plan on this dog, we can do we can evaluate the muscle girth. Also, we can do the range of motion test as well. Also, we should assess the patient's pain. In most dogs with IVDD, they're mostly in the acute pain, and we can use this two forms. Like this one is the I think one is the Colorado State University. We can see the pain score of this dog, and another one is the Glasgow Composite Major Pain Scale in canine, and to see whether the acute pain, what level of the acute pain of these dogs are. So there are some papers. We can see there how photobiomodulation therapy can help these dogs. Rehab can be done with patients with surgery or without surgery. So here are two papers that can be the doctors, if they're interested in. There are some interesting papers that the doctors can have a look. And now we're going to see some interesting cases. So the first one is there is the paralysis caused by the herniated disc, and this dog came to the hospital with a very poor ability to work, and the doctor diagnosed that this dog has a lumbar disc herniation. And after discuss with the owner, the vet planned a conservative treatment, and they used the built-in IVDD protocol to do the laser therapy, and it's once daily in the first week, and every other day in the second week, and there's twice daily weekly. And after 2 weeks of treatment, the dog is able to walk and run with the support of wheelchair, and the treatment lasted for about 2 months, and half a year have passed, and there is no recurrence until now. Okay, so here is our case study, and this is a case which happens in the beginning of my rehab career. The dog is called Kane, which means money in Japanese, and it's a 5.5 kilograms neutered female long-haired Dachshund. And it is a household pet, an indoor dog, and the owner has owned Kane since she was a puppy. And the patient's history problem is on the 16th of September in 2017, Kane was not able to ambulate on the hind limbs, and it happened all in a sudden. And when the owner came home, it saw the dog was dragging her hind limbs when walking, and it's a lot of pain when the owner is trying to touch the Kane's back. However, the spirit and appetite is normal, which is a normal Dachshund, but there is another finding that Kane was not able to urinate and defecate. So the observation is, first, the dog is reluctant to walk, and there's a hunchback when standing. And the gait assessment, it's a grade 0 neurological gait. There's absence of purposeful movement of the hind limbs, and the dog is obvious paraplegic. So we do our neurological examination. The patellar reflex is +3, sciatic reflex is +3. However, the craniotibial reflex and the gastro reflex, it's normal. And there is the cutaneous, we do the cutaneous trunci reflex. There's abnormal L4 region and the perianal reflex, which is normal, which is a good thing. And the deep pain is positive, which is good. The cross extension, it's normal. So it's upper motor neuron of both hind limb on the left and the right. And there's knuckling on both legs as well. So in upper neuron, in this UM lesion, which is a good thing we have discovered, because we know about the UMN and we know about the LMN. So we're more UMN and LMN is a very good tool for us to predict the prognosis of this dog. If today Kane presented the LMN on the hind limb, which means the leg is very weakened, there is no muscle tone, the prognosis will be quite bad because it's affecting its motor. Okay. So we do the neurology examination. These are the videos I'm going to show you. First off, it's the deep pain. We can hear the dog is whining when we're doing the deep pain, which is the good thing because there is still pain sensation, which means the compressing is not that serious. Then we do the cutaneous trunci examination. We can see it stops. Right. Okay. And the placement, you can see there is no CP on both hind limbs. And we finally do the gait analysis. So the thoracic limb, which is the front limb, they're both normal. However, the hind limb there is like pelagic. And we asked the owner to do the CT, and as well as we took an X-ray, and we can see there is the definite diagnosis, which is the Hansen's type 1 intervertebral disc disease of L2 and L3. So we can see there is the herniation up here. And here's our treatment plan. We decided to do the hemilectomy decompressing surgery on the 18th of September 2017, and we have our rehabilitation treatment followed by the surgery. And there are some doctors ask about how fast can we apply rehabilitation after this kind of surgery. Well, my answer is immediately, like right after the surgery, we can do such as like cryotherapy to soothe all the hemorrhage or like to soothe the surgical area, because there might be a lot of like hemorrhage around the surgical area. So using the cryotherapy in the very beginning after the surgery, which is which is a very good thing. And however, right after this kind of like hemilectomy surgery, you should we should make the dog in cage rest for a few days to see how it goes, and no other like excessive or like no other really like aggressive rehabilitation should be done. So here is our rehabilitation treatment goals. First of all is pain relief. and we want to reduce the surgical edema and inflammation. So we applied the cryotherapy, and then we want to maintain the muscle mass and reduce muscle spasm, especially the quadriceps and the longissimus muscle. And we want to restoration of the proprioceptive of the limbs and enhance the strength of the core muscle. So this is our rehabilitation treat goals. And what we do in the first week is the top two, the pain relief and reduce the surgical edema and inflammation. This is our goal in the first week. And then when the edema and the inflammation gradually went away, then we start to add more like maintain the muscle mass and reduce the muscle spasm, and we can do some of like the assist standing with the dog. Okay, so this is what we do. This is what we did. Like the post surgery 3 days, we do the cryotherapy on the L2, L3, and we do it 10 minutes and twice daily. And then we do the massage, very, very soft massage around the hind limb. Like we do the effleurage on the petrissage. Then we do the passive range of motion on the hind limb as well. And we do the laser therapy on L2 and L3. And the TENS, which is for pain relief. So we applied TENS. Then we gave the dog the pain control medication. So this is the physical therapy evaluation on the 22nd of September. The dog is still not able to bear weight, and there is like grade 1 severe paresis, and it's also upper motor neuron deficit of the hind limb. So here is the video. We can have a look. It looks improve a lot because we have removed the material compressing the disc. Okay, so this is our neurology examination. It has improved. However, the patellar reflex of the left and right, it's still hyper, and there's still UMN, and the hind limb is still knuckling. Okay, so this is what we asked the owner to do at home. The Connie was discharged on the 22nd, and we gave him antibiotic and pain control as well as the vitamin B12. And we asked the owner to do the ice pack, to the cryotherapy, and we can do the passive range of motion, like the extension and flexion of the hind limbs 10 times per cycle and 2 cycles per day. And we asked the owner to do the standing 1 minute twice daily, and the bladder expression, as well as restriction of the active area, and there's no jumping. Okay, so this is the first rehab visit 7 days after the surgery. So we can see it's still knuckling, and here is our neurology examination on the 30th. So we can see still patellar reflex still hyper. However, the knuckling still present, but was able to put the pull back after about 4 seconds or occasionally on the left. So the problems and goals on the 30th is there's back pain, loss of full proprioceptive on both limbs, spasm of the quadriceps and longissimus muscle, and we want to maintain the muscle mass and prevent atrophy, enhance the strength of the core muscle, and we did a muscle girth the muscle girth of the hind limb is about 14.6 on the left and 14.4 on the right. So we do the cryotherapy, we did the massage, we did the passive range of motion, and we do laser therapy, 8 joules per centimeter square on L2 and L3 area. We use 10 for local pain control, and we do the assist standing as well. Okay. So after 2 weeks after surgery, we can see Kahane was still not able to bear weight on the hind limbs. Okay. However, the knuckling has improved on the right. So the patellar reflex on the reflex was a bit better, And we can see the knuckling was able to put the pole back after 2 seconds occasionally. Still, we do every evaluations. There's back pain, still back pain, loss of full proprioception of the both hind limbs, spasm of the quadriceps and the muscles on the back. We still want to do the same thing. And gradually we're adding more and more rehab to these patients. We started to do some assisting on yoga ball. We even do the ultrasound as well. You can see this is 3 weeks after the surgery. Still a bit paralysis, but it seems like the dog was able to to bear a bit of her own weight. Okay. So we can see the right still knuckling and the CP on the left has improved and there is no upper motor neuron deficit here. Okay. Still, this is still our problems and goals to do all what we can do. And however, there is some muscle atrophy on the right hind limb due to, I think it's due to because the dog has not been walking properly on the right hind limb. This is our rehabilitation menu, and we still do laser as well. We do TENS, assist standing, yoga ball, pretty much the same. And this is like 4 weeks after the surgery. It seems the dog is walking much more better than the last time the Kane was able to bear weight on the hind limb. So this the CP has been is normal on the left, and on the right there is still not knuckling on the right limb, but is able to put the pole back to the correct position after 2 seconds. Okay. And our goals is pretty much the same. However, the dog was able to walk, but we can see in our gait assessment, there is kind of like the swing on the right hind limb when walking, which means that there's not enough strength on the right hind limb. And this is what we did. This video is very interesting. This is what I did this is more like a balance training to make sure this Kane has bear enough weight on the hind limb. So this is what I'm going to show you. We can see the dog is still not it's not walking very stable, but we're trying to use kind of like this balance board to train the core muscle and train the muscle as well. So here on the 7 weeks after surgery, we can see Kane was able to bear weight on the hind limbs. The gait assessment has been improved, and the the placing has been normal on both limbs. Okay, so there is also some problems. We want to enhance the strength of the core muscles, and we want to increase the strength of we want to train the muscle strength and want to regain the more normal gait of this dog. So we still do therapeutic ultrasounds. This is pretty much like a heat therapy, like to warm up the dog before doing any like rehab session. And we do massage before the rehab. We did passive range of motion with laser therapy together. And we turned TENS into NMES. This is kind of like the electrical stimulation, and we try to build muscles. And we do the balance board and we do the cones turning exercise. This is what we're doing. And observation, Connie was able to bear weight on the hind limb, and the gait is pretty good. Still a little bit of like the bunny hopping we can see from this video. However, the neurological examination has been improved. And this is what I trained. This is not a very good example because I think there should be a mat. Should be like the yoga mat should be, because the floor is a little bit slippery. Okay, so this is what I think I should improve when I'm doing this rehab. So this is pretty much like the cavallati to try to train the dog when train the proprioceptive reaction. Okay. Generally, the dog is doing quite well. And the problems on the December on the 11th, there's spasm of the quadriceps and longus as a muscle. We want to maintain the muscle mass and prevent atrophy and enhance the strength of the core muscle and regain the normal gait. And the owner took the dog to the swimming pool to do some aquatic therapy. We can see the dog is still not using the right hind limb very well. So this is pretty much the entire case, and there's some there's some questions that I ask myself. What could I have altered in the physical therapy care in this case? I think first of all, I should increase the frequency of the physical therapy for the first 3 times, because I asked the owner to come back like weekly. I think it's better for the dog to come back like twice weekly. And I think more laser therapy can be applied to like right after surgery, because it kind of like enhance the regrowing and decrease the edema, which can facilitate the wound healing. And I think because this dog didn't do any underwater treadmill, and so I think the underwater treadmill could have been applied to facilitate and to train the coordination of the dog's gait. Also, this is pretty much the end of the day and the end of the webinar. So I just want to ask if there's any question from all the doctors.
Thank you very much, Dr. Lin, for your wonderful talk. And I'm sure you may have a lot of questions for Dr. Lin. And now it's time for question and answer. We have already seen several questions in the Q&A area. It's great to see how proactive everyone is. And please feel free to answer at Zoom.
Okay, I think there is some questions here. So I'll start with the one who's asking, how do we evaluate the effect of laser therapy, in particular when applying laser therapy combined with other treatment methods? Actually, I think laser therapy is one of the therapy can control pain and accelerates wound healing. So you can do it like, because when we're facing patients like in IVDD patients, most of the time we do not do one thing at a time. We just add whatever we can to help these patients. So first of all, we can do like, we definitely gave them the pain control, like pain like NSAIDs or NSAIDs, and which is for pain control. Then we do laser therapy, and we might do some of like the TENS for the pain control. Because these kind of pain control they have different mechanism. So it's hard to tell that how do we evaluate the effect of laser therapy. It's impossible for after doing a surgery, we just gave the dog laser therapy. This is impossible. We must add a lot of things together. However, there are some papers that showing that when you're doing the laser therapy itself, it helps with the pain control. It happens, but in clinically, it's hard to do just one thing at a time. Okay, so. And there's a second question asking about, can we use laser on the epilepsy dogs? Myself, I did laser therapy in seizure dogs before. However, it depends on which part you're doing. If there's a seizure dog when you're doing the if there's a if this dog presents a seizure, like occasionally, like if it's like very bad seizure, I don't think it's a good idea to do any laser on them. However, if the seizure has been controlled and you're doing the laser for the orthopedic problem or like the osteoarthritis, you can do laser on these kind of patients. Okay. So here's another doctor asking that, and they attended the session yesterday, and they want to ask my suggestion about laser acupuncture and he would love to grab information from different perspective. I think it works because acupuncture is different field, and when you combine laser with acupuncture, I think it definitely helps these patients, okay, to facilitate them. And now every machine they do have the laser acupuncture like scenario and acupuncture mode for you to use. So I think it's good to use laser acupuncture in dogs. And then here is another one asking, do I mind recommending resources to system study laser in vet medicine? I think I show you a few papers. I think you can grab those information, okay? And how often would you be using laser? I think using laser, there is like when you're doing laser, it doesn't mean like when you're doing like twice daily would be helpful. It's not like for like acute patient. I think like for surgery patients or for acute pain patient, it's better to do it once every day, which is pretty enough. When you're doing like twice daily, I don't think it's a good idea, because or it does not harm the dog anyway, but it's not going to accelerate wound healing because the tissues they need time to recover. So when you're doing like twice daily or you're doing 3 times daily of laser therapy, I don't think there's going to be any change with when you're doing just once daily. So I think it's better to do like once daily for acute pain. When you're doing for chronic pain, I think it's better to do it like 3 times, once every 3 days. I think this is pretty good enough. So this one is, how many laser points did I use for these case and how much time would I take? Because in this case, I'm using the 3B laser, which is I'm using the class 3B laser, which the energy is not that not that big enough. So I do the laser on the L2, L3 region, which is the surgery region. Also, I did the laser therapy on the both quadriceps as well for the which is like connecting to the sciatic and femoral nerve. I do those points as well. So there'll be 1, 2, 3. I do the IVDD mode, then I do the pain control mode, and I do the inflammation mode. So one area I did different modes. So it's about 3 different modes on one specific place on the spine area. And for the hind limb area, I just did the inflammation mode. Okay. So I think this is completed. We don't have further questions now.
Okay, thanks for Dr. Lim's answer.